The Open Therapy Institute is addressing bias in mental health care. Go to our website, opentherapyinstitute.org. We have CE credit workshops about overlooked issues in the field. You can go to our workshop page and register now and become a member. And for those looking for a therapist, we match people with someone who's highly skilled and truly open. Just contact us through the contact page on the website or email us at info@opentherapyinstitute.org. Hi, I'm Leslie Elliott Boyce, and I am speaking with Andrew Hartz of the Open Therapy Institute for another installment of our series of conversations for the Open Therapy podcast. It's nice to see you today, Andrew.
Good to see you, Leslie.
So I have several thoughts about what we could discuss today, but something that's really salient for me right now is that the other day on Sunday, the 17th, Benjamin and I attended a conversation panel that was being hosted by Women's Declaration International at the Seattle Public Library. And it was a number of women speaking about a case that was having oral arguments this week in Seattle for the Olympus Spa issue, which, if you're not familiar with that, it is a spa for women. There's a bunch of these around the Seattle area. These are Korean spas, bathhouses. Women go. There are some of them host men's areas too, but it's sex segregated because everybody's nude, and it's just you're in there, you're bathing, you're in hot baths and salt baths, and it's a lovely, relaxing atmosphere. I've been to these before. They're really nice, but they are sex segregated, and so a trans-identified male contested this, and now it's gone through a couple of legal hearings. I think that this was decided in favor of the state, the plaintiff, the trans-identified male who wanted access. The state of Washington said that was going to be required of the spa. They had to allow, if a person is a trans woman, they cannot be discriminated upon against. They need to be allowed access. And so there's been an appeals process, and now there were oral arguments this week. But this was a really nice event. It was attended by, I don't know, probably 80 to 100 people, a series of speakers, Amy Sousa, Kara Dansky. There was a woman, Elle Palmer, who is a detransitioned woman, who gave a speech as well. There was a woman who was there to represent the Korean community, talking about the culture and the importance of these bathhouses, and a couple of other speakers as well. And there was a large crowd gathered outside for the express purpose of driving out this group, not allowing this group to speak. And on our way into the lecture, Benjamin and I were assaulted a number of times by this crowd in full view of the police, which was, it was really kind of shocking. We were body checked and pushed and broken apart. And
Really?
it was really
Wow.
alarming. There was I felt a lot of adrenaline. I just felt this need to just get in there and get away from these people. And, and it raises a lot of thoughts and questions, about what are we doing, allowing these kinds of things as a society. The crowd that is there for intimidation purposes feels like a very different thing from free speech. And yeah, this is something that's been on my mind, and I'm curious to hear your thoughts about this phenomenon and
Yeah.
and just where you would go with that.
Yeah. Really, really interesting. I guess I kind of have two thoughts. One is kind of like about basically it's male to female, trans-identified people being in bathrooms and other like women's spaces.
Hmm.
And I just wanted to kind of like basically slow down a little bit because I think people have very strong emotional reactions, and just to kind of like set that aside for a second and think about what the like I think there's an empirical question here. I think this
Mm.
is a falsifiable thing that could be measured and shown one way or the other. And the question is, does letting this population into female spaces increase harassments or assaults. And the concern is that there could be people maybe with a transvestic fetish or
Mhm.
another fetish, especially if they don't get surgery, where they would feel, go want to go in these spaces and kind of exploit this loophole, or maybe truly identify as women, but still have a fetishistic
Mhm.
attitude about this, and either be harassing or disturbing
Mhm.
or getting off on the experience in a way that would be really disruptive, or even leading up to sexual assault.
Mhm.
And the question is, would this policy increase the incidence of those types of behaviors? And I think you could think of lots of different policies. Maybe you could have a policy that's like only if you've had genital surgery, so no penis and testicles,
Mhm.
basically. And what would that be different than saying it's just how you identify? How would it be verified? And you can think about this in like locker rooms and bathrooms and obviously spas, but any spaces like this where somebody might want to do this. And I think that the claim of the activists, as far as I hear it, is that there's zero chance that this will increase any of this behavior, which I,
Mhm.
which which I find totally implausible.
Mhm.
But it's falsifiable. Like you can actually like look at places that have this policy versus places that don't, and look at whether or not incidents go up and down, and you can probably come to a pretty clear conclusion. But it seems like it's hard for me to imagine that they're not increasing, even if most trans-identified people would never do this and would be non-disruptive, and that could very well be true. And still, the instance of this behavior with these policies could go up dramatically. Um, the other related question, I think, which is also really important, just has to do with discomfort,
Mhm.
which I think does really matter. Um, it's different from I think the sexual assault question and the sexual harassment question really can be, verified. I think the discomfort question is more interesting because the activists would say if you're uncomfortable with a anatomically intact male who's wearing makeup in your sauna,
Mhm.
that is purely a result of your transphobia. And there's nothing, it's almost like there's something that I think happens a lot with identity politics activists on the left in particular, that there's a lot of emotional invalidation. That if you have a particular, I don't think it's just with this issue, but if you have a particular emotional response to something, it's because you're a bigot, and they're trying to push people to invalidate what they feel, or not see what they see with their own eyes, and say, oh, if I'm uncomfortable, it's not because there's anything threatening here or anything complicated or upsetting here. It's on me, and I have to invalidate my emotions to accommodate this other person. I think that's very dangerous, and you can kind of see how that can lead to people. I think a lot of people on the left actually do that to themselves.
Mhm.
And I bet there's people who are on the side of wanting trans-identified people to go into the sauna, who themselves feel discomfort, that actively they try to annihilate it from their psyche because they think the fact that they have it means they're bad. And then they want to kind of use these shaming, threats, attacks to get other people to invalidate their emotional
Mhm.
reactions. But it is like, it's part of the equation too, right? I mean, part of the equation is like everybody's comfort. We're kind of thinking about what's the best decision to do as a society. Everybody's feelings should presumably matter.
Mhm.
And I can see why people would have discomfort or even be disturbed. I had an anecdote from a colleague who was at a gym. He's male, but this woman came in It was a man with a hairy chest
Mhm.
and full breast implants and a penis. And walking around just kind of like strutting around the gym,
Mhm.
strutting around the locker room
Mhm.
naked. And he's like, it was incredibly disturbing.
Mhm. Mhm.
And he said that everybody was trying to pretend like they weren't really disturbed by what they were seeing, and also kind of like killing their thoughts about it. Like, not thinking about like, why is this person doing this?
Mhm.
Are they getting off on it? Are they being aggressive with it? What is this? What is the function of this for them? Or do they like disturbing us and we pretend like nothing's happening? Um, because it's strange. Like I'm fairly anatomically normal, man. I don't strut around the locker room naked
Mhm.
for any amount of time. I like immediately get my clothes on. So like I think like not saying that like sometimes a guy will do that and you're kind of I think it's weird when anybody does it, but it's like especially weird here. And it's like, what's the function of this for this
Mhm.
person?
Mhm.
And everybody's got to kill their thoughts about it and annihilate their feelings about it to pretend like it's normal, or else they're a bigot. And it's
Mhm.
kind of like there's something off about that you're not allowed to have your normal feelings or your authentic feelings, and you have to like kind of annihilate part of your psyche in order to conform to this dynamic, or else you're a bigot.
Yeah, I think those are really good observations, and that's a useful framework to look at it in those two ways, like, the discomfort, but also the empirical evidence of whether or not this ever does cause problems for people. And I am, I think that the SPA's position previously was women and post-operative trans women were welcome. So, to your point about
Right, right, right.
genitals, and very uh, infamously now, one of the attorneys in this case used the phrase vaginally presenting people, which is really funny because I don't know anybody who just presents with their genitals. That kind of sounds like your strutting example. But
Right.
in the sort of verbal gymnastics that we try to do around the word woman right now, I guess that's one of the phrases that kind of came up. But yeah, it's the point about whether or not there are ever bad actors is a really good one. I think that there's, again, it kind of comes back to this thought that I've had for a while, that we have sort of a schema mismatch. When some people are thinking about a trans person, they're thinking about a person who has no desire to interfere with anybody else's life, is really just trying to grapple with a very difficult set of physical and emotional and mental circumstances. And this is the way that they have chosen to alleviate the distress that they feel about their own body through uh, gender reassignment surgery, through cosmetic and surgical, as well as medicinal routes to alter their physical appearance so that they can live in better peace with themselves and can blend in as well as possible and just have a normal life. So I think for a lot of people, that's the person that they're picturing. But when you make a blanket policy statement that just says, if you identify this way, we're going to take your word for it. We're going to assume that that's who you are. This category that I just described, you with that blanket policy, you also open it up for people who just want to goof around, who have bad intentions, who are maybe narcissistic and looking for to get a rise out of other people, maybe are just voyeuristic. If I can just claim to be a woman, if someone who
Yes.
who like
Yeah,
you
yeah,
said is a
yeah.
normally anatomical
Yes, yes, yes.
male, can just say, I'm a woman today because I'd like to go into this spa where all these women are going to be nude and I can just hang out there. If you force a business to allow anyone in who just claims a certain identity, you're opening it up for a lot of mentally ill or criminally deranged people to be able to access that space. And as you said, we have cases like that. We do see cases like that. So, this desire to alleviate or the issue of comfort too is really interesting. I think it blends right into that to the first framework too, because women being uncomfortable with sharing their spaces with anatomical
Right.
males um, is just don't worry about that. Why are you looking at genitals anyway? If you don't like it, stay home. Your feelings don't matter. But the whole reason of expanding the policy is to accommodate the comforts of this minority of people. And so
Right.
it's not about we don't care about your comfort. It's we don't care about this group's comfort. We want to
Yes.
prioritize this other group's comfort. And when you have a very small number of people, a percentage of people,
Right.
why make a policy to favor their comfort when it's going to alienate the majority of the people who would be using these services and also cost businesses quite a lot of patronage? In this case, the
Right.
spa is in danger of going out of business because of the ruling against them. Because
Yeah.
now women who would like to go and relax in the spa and have done so for a long time are
Right.
staying away because they're afraid that the space has been opened up for bad actors or, just people who might want to come in and be fully anatomically male and enjoy the space with them.
Yes. Yes. Yeah, I think right. The discomfort can be a signal of anything, like of real stuff, of something real.
Hmm.
And I think it's really dangerous to start telling people your reaction to something you're not allowed to have it. Like
Hmm.
if you can't trust your own eyes, you can't trust your own intuition, you have to think this other way. I think that's a very unhealthy way to interact with the world. Um, I think what you're saying also about the schema of like what is the prototypical trans person who
Hmm.
really just wants to live their life in peace and they have this kind of they were born with this identity and they
Hmm.
just want to get by if it wasn't for all the bigots and then I think but it's clearly not entirely accurate. Like I think
Hmm.
like there's just like there are people who have fetishistic desires that attract them to it, and people who have other dynamics that lead them to these identifications that aren't so simple. And it does seem to me that that overly simple representation of all trans people are like this particular thing that I'm most comfortable with. It's another kind of thought killing
Hmm.
thing where it's like what's happening and why, like there's just no curiosity. I'd say there's a fear
Hmm.
of really reflecting on what's happening and thinking about like where did this identity come from, what are we really saying it came from, like
Hmm.
what are they motivated by, what's their life like, what's their personality like. um I think there are a couple things that are really, really different about the trans movement as opposed to the gay rights movement. Like that couple of things that really strike me as very different. One of them is the gay rights movement really became successful primarily by saying live and let live. It was like you can do what you want and let us do what we want and you'll be left. Now, as soon as the Supreme Court ruled on gay marriage, I think the entire LGBT movement changed its tenor
Hmm.
and it became much more about trying to root out and destroy anyone who disagreed. And that seems to, so it became much more coercive, much more intrusive. Um, and the trans movement, I think, is the most that way. One of the things that strikes me as just a non-rigorous observation is that my experiences, like you'd see somebody who's gay, or you'd see an old friend who used to seem miserable or really tense, and now they're very relaxed, and you'd say, "Oh, well, what happened?" They'd be like, "Well, I finally came out of the closet,
Hmm.
so now I'm just much more chill and much happier, and I feel like my life's a lot better." And that was like a template that I think enough people have had that experience or known somebody who had that experience or something that it's like it fits. And with the trans movement, there's something, it feels so different.
Hmm.
I don't know that I've really had those experiences of like why are you doing so much better psychologically? It's like, well, I finally got transitioned, and so
Mhm.
that's why I'm doing so well. It almost seems like it's and the movement itself, I think, really the tactics of the movement
Mhm.
are really noteworthy for the extent to which they oppose dialogue and even oppose research and try to attack individuals, including with like physicality, with threats, with trying to like, you know, we're, in the mental health field, like we should have a robust discussion about what's the best treatment procedure, what are the different options for treatment, what are the different outcomes for different subpopulations, what's the longitudinal data look like. I can't imagine opposing good faith research about what does the best care look like here for in
Mhm.
terms of short and long-term outcomes. What's really going on here? Can we understand this so that we can actually like respond effectively? But if people try to do that, really trying to go after people's licenses,
Mhm.
trying to like defame or dox them or threaten them or even getting physical and screaming, it's the tactics of the movement. I'm really scared if these tactics are seen as being a successful way to do politics moving forward. I
Mhm.
mean, if movements can really just kind of like seize bureaucratic bodies and destroy their enemies and threaten people, and
Mhm.
and that's how they amass power, and that works. I think that's a very dangerous precedent. Violence really can't be the way that this progresses. But it does seem like in the trans movement, there's a comfort with violence, threat, harassment, really trying to destroy anyone with a different view. There's not this sense of like, hey, look, this is a new thing. We don't have a lot of data on it. Let's win with our arguments. Let's win with goodwill. Let's do positive things. Let's show how much better the world can be with trans people in it by being positive or whatever it is. It just seems like there's so much of this viciousness that I'm as concerned about the tactics, maybe more concerned. I mean, might even be more concerned about the tactics than the content.
Yeah, I'm actually interested in your perspective from a clinical read on this. So to your point about the live and let live versus what we're seeing now with the trans movement, what
Yeah.
several years ago I was out with a friend, a good friend of mine. She is a lesbian, not was, she is a lesbian. And we were at a farmer's market. We bought something from a vendor who we both took to be a trans probably a trans identifying female, because this individual was clearly a woman, but was dressed, masculine, which could mean nothing because women wear gender neutral
Right,
things all the
right.
time, but also had significant facial hair. And so
I
as we
see.
were walking away, we had a pleasant exchange with the individual and purchased some of the crafts that they made. And when we got back to the car, we had a conversation around tolerance versus acceptance. And my friend, having had the experience of feeling very discriminated against and feeling like she had to come out at a certain point, and that she'd gone through that same kind of feeling that you're describing of relief finally to be able to be open about her own identity with her friends and family. She had a different take on this than I did, and she felt like acceptance was necessary. Tolerance is not good enough. And it was a really interesting and illuminating conversation to hear that she had that perspective. Um, but one of the things that I think that I see happening is, for instance, I've worked with a number of trans identifying young clients. And what you see is the coming out is followed by an immediate demand that other people affirm. So it goes back to something that you talked about
Right.
a, a few conversations back when you were describing how the contagion of splitting, the contagion of black and white thinking can
Mm.
kind of happen. And I
Mhm.
wonder what you're seeing with this, because you are not you're denying my existence if you keep calling me my birth name, which they now call a dead name. You must refer to me as my new name, and you
Yeah.
must refer to me with my new pronouns. And so some parents will try to skirt that by not using
Right.
third person pronouns around their child or not calling them by any name. But in the case of families who speak a different language where the entire language is gender coded, they
Right.
can't really get away from having to make a binary choice with regard to pronouns. And you
Mm,
find yourself really quickly at an impasse where if you deny this person's request, you
right.
are invalidating their very existence according to this framework. So there's no room in this presentation for a neutral stance of tolerance of like, I see that that's how you're
Right.
feeling, and I support your ability to explore your identity, but
Yes.
I'm not going to take a position on it. You're automatically put in the position of being forced to take a position.
Well, I think it's really important that people know that nobody has a right to control other people's psyches.
Mhm.
Nobody has to accept you for anything. You don't get to control other people's psyches. Nobody has that right. No one. And so, I mean, thinking about the idea of tolerance, really, like, I think, I don't know that this is historically accurate, but my sense of it is that it started with like religious tolerance. And it's like, you can practice your religion. I disagree because I have a different religion, but I can still be your neighbor and do business with you and not kill you, basically. And that's good, you know? Uh, people can disagree, and we have to allow people to disagree. And you could be rejected for any belief or value that you have that they think, well, I think people that think that are all going to hell. You know, that's going to happen, you know? So they can still be your neighbor. You can still get along, but like you have no right to control other people's psyche. And I think there is something about an impulse to somehow use the state or other state adjacent institutions to force people's psyches to conform, not even consciously, unconsciously, to force through state coercion the unconscious to be structured in a way that fully embraces something. It is dark.
Mhm.
It's a dark impulse. I and I think it says something about the movement that that's so crucial. It's you cannot do that for anything. I think it is interesting about being like it's interesting you're talking about being like you're forced into a binary
Mhm.
by having to make the choice or not. Um, the main thing that it reminded me of when you were talking about not dead naming and you can't mention anything about my past identity was Roberto Giangelo's brilliant talk at the Segment conference just a month ago. And absolutely brilliant talk. And I think where was the paper he wrote published?
I'd have to look it up.
It was in a psychoanalytic journal,
Mhm.
but it's worth Googling and finding this paper because he did talk about something it's interesting to say, I had this whole life under this name and gender for 17 years. And if anybody mentions it, I will fall to pieces psychologically. Uh, it's just another thing that doesn't it makes the I know not everybody who's trans feels that way. Or everybody with that identity feels that way, but it's a um it's concerning. It's another thing that makes it seem like this is not an identity that's the hallmark of stability.
Mhm.
A big part of the claims of the movement, obviously, people who identify as trans have much, much higher rates of mental illness. And a
Mhm.
central claim of the movement is 100% of that is caused by transphobia.
Mhm. Mhm.
They haven't really shown that with evidence.
Mhm.
But they assert it. And they say that if you disagree with that, then that's transphobic.
Mhm.
But things like not being able to refer to decades of your life without psychologically decompensating, that's concerning. That does not sound like mental health to me.
No, it is
And
really concerning. It is. And I wonder though if we are to like look at at what do we have previously that represents sort of a similar pattern or analogs to that, maybe on a less escalated scale. One of the things that came up in one of our solid ground discussion groups several months back, maybe even a year ago, is really interesting conversation about rites of passage and the absence of rites of passage in American life right now, American coming of age. It's like you kind of you go through high school, yeah, you graduate, but you still have to go to college. You go to college and then you graduate and you don't just like immediately you get a job. Maybe you have a ceremony, but there's something missing in this, like now you're an adult, you can take on more responsibility. And so there's in historically we've seen lots of cultures have such rites of passage, and one of the hallmarks of that in some places and times is a changing of your name or an adopting of a new sort of, I guess, a new adult identity to show the world. And so I wonder if on some level this is just representing a sort of unhealthy version of a very normal desire to to remake the self and say I'm no longer just that kid, I'm somebody else. So there's a flight from self, which does not include an integration of the former self and the now self, but
hmm,
perhaps there's a more integrated version of this that's always existed to some. So one of the examples, I used this recently when I was talking with one of my young clients who's really
yeah.
upset about parents not using the name of choice. And I said, well, my brother, when he was a kid, we all called him Jimmy. And then one day he said, I'm not Jimmy anymore. I'm James. I want everybody to call me James. And so he went to school and he was James now. And his classmates and his teachers called him James. And uh, my parents both tried very hard to remember James and call him James. But his older brother and older sister, we're like, what is this pretentious James stuff? We're just calling you Jimmy. And so we stuck with Jimmy. And all these years later, he's a man in his 40s, and my brother and I, we still call him Jimmy most of the time. You know, it's just he's like he's always Jimmy to us. And so there's this. I I think that there's a desire to, and I did this too when I was in high school. I went a year calling myself Jenny because my first name is Jennifer, and I'd
Hmm,
never gone by it. But
hmm.
I went for a year where I was like, I don't want to be Leslie anymore. I want to be somebody different. I'm Jenny now. And I wonder if like this has existed to some extent for a long time. We don't have to necessarily pathologize the desire to show up as a new version of oneself. But what seems really problematic is this black and white thinking, this you don't want me to exist. You're dead naming me. Like you said, I'm going to fall apart if I hear mention of my
Right, right,
former
right, right,
identity that I was
right.
comfortable with for all those years.
Yeah, or yeah. I mean, it's an interesting idea to think that the coming of age thing could be playing a role. There are so many things that could be playing a role in it that are worth understanding. And I definitely think trauma is part of it. I definitely think internet pornography is part of
Mhm.
it,
Mhm.
and internet culture is part of it. I think other types of discomfort with sexuality or with growing up could be part of it. It's an incredibly complicated thing. I don't think there's one prototype. I think it's pretty clear that there are several different pathways that can lead in this direction, and they're varied. Uh, Parents' influence can be really important. So I think there's a lot of different things that could be pointed into it, and I just don't. I don't like the idea that we're not allowed to talk about it, that we're not allowed to research it. That's how we're going to understand it. that's how we're going to end up ultimately being able to provide better care
Mhm.
for this population. I think they're poorly served if clinicians don't have any theories or research in order to help different people who come in with different things. I'm asked for my professional opinion on something like this. I should have some data to point to and some theories that are evidence-based to give wise counsel to people. Now, that's totally distinct from, do they have a right to live their life a certain way? Um, but there are these complicated issues with public policy too that have to
Mhm.
be informed. But I don't like the anti-science strain of it. I don't like the anti-research strain of it. That you have to have people with diverse viewpoints writing about this, researching about it, talking about it to get a good evidence-based understanding, or the care is going to suffer. And I think it's also harder to like resolve these questions. Like if like let's say they're right, like the most extreme case is right about the spa thing. They're not more likely to commit sexual assaults. They're like you change the policy and guess what? Nothing increases. No sexual harassment, no sexual assaults, nothing like that goes up. It's total myth, total fantasy.
Mhm.
Wouldn't you want researchers on both sides doing these studies, coming to an evidence-based consensus showing that you were right?
Mhm.
But you can't do that if you destroy everybody who wants to talk about and investigate this issue empirically. So if you're totally right, like let the data shine,
Mhm.
totally win everything, and you have victory.
Mhm.
But I hate not being able to looking into it. And
Mhm.
I think there's a high probability that's not going to be the case and that they know it, which is why they're fighting the science.
Mhm. I think you're right, and I think that the dangerous part is the policies based on assumptions of the best case scenario, because we just know
Yeah,
that there are always going to be people with criminal intent. And if you provide them a really easy loophole, like just say that you're a woman, you don't have to change anything about yourself. Just say you're a
right,
woman,
right.
and here you are. So,
It doesn't pass the common sense test.
no.
And that's why you really need these thought killing. You really
Sure.
need a lot of thought killing. You need to kill curiosity, kill
Mhm.
reflection, kill your own emotions about it, kill your cognitions about it. You need to use a lot of threats and intimidation to encourage other people to kill their own thoughts and feelings so that they can conform with this. Um, and those strategies, I think, are just as in a lot of ways more concerning to me than the claims.
Absolutely. Well, thank you for being willing to go into this conversation with me. It's been a really interesting perspective, and perhaps we can revisit it in more detail at some point in the future.
Thanks, Leslie.